The need of our treatment. Hello and welcome to India Top Doctor. No, I'm not talking about the actual art, and I'm sure many of you are unaware about the term art in medical field. Worry not today. We have a very special guest, Dr. Kaberi Banerjee. She is going to give us a deep insight on this topic. Dr. Kaberi Banerjee leads Advanced Fertility and Gynae Centre, known as the best IVF center in India, providing the best IVF services at an outstanding assisted reproduction center located in Delhi NCR, easily accessible via all forms of transportation.
Art is actually called as ART. It is Assisted Reproductive Technologies. And anything dealing with reproduction, which is done outside the bodies in the laboratories, is called assisted reproduction and is usually meant to describe procedures like IVF and ICSI, which is in otherwise layman's term known as test tube baby. So anything that is done outside the body, sperm preparation, intrauterine insemination, in vitro fertilization, intracytoplasmic sperm injection, blastocyst transfer, pre-implantation genetic screening, all this is in the realms of ART. See, as much as 10 to 15% of the couples in the reproductive age group face some form of fertility issues. So, though most of the issues can be sorted by some proper advice or medications or minor or major surgeries, there are certain problems, for example, tubal blockage, very poor sperm count, that would need the help of assisted reproductive technologies, and that has a very high pregnancy outcome. Now, if people are not aware and if people have myths and suspicions and issues about this technology, then they would not come forward at the right time to avail it. And in fertility treatment, time is of essence, and therefore it's important that people are made aware of the presence of these technologies to assist them if needed. See, the government has already taken a very major step of bringing the ART as a law and the surrogacy as a law and trying to streamline it, trying to make certain basic parameters that must be there in the gynecologist or the embryologist or the laboratory. So the government is trying its best to standardize this whole technology, which is a great step from the side of the government. Of course, this law has certain issues. For example, the penalty clause that has been associated with the provider of the treatment is something, these are issues that are debatable. But overall, the main purpose of this law is to make it more patient friendly. So the government is already on its way to make ART more patient friendly and standardized. But over and above that, some form of public education, media education, school curriculum inclusion, all these things should be there to make fertility treatment more accessible and easy, and something that can be discussed easily and not always, covered in secrecy and privacy. See, it depends on multiple factors. First factor is the age of the lady. So, younger women conceive easily, and more than 33, 34, it becomes difficult. After 38, it becomes very, very difficult. Beyond 40, it's almost quite impossible with own eggs sometimes, and you would need to resort to donor eggs, etc. So third party reproduction, of course, is a different thing altogether, but age is very important when you consider when. And then is how long has the couple been trying? That is also very important. If it's a young patient, young couple trying only 1 to 2 years, no other associated factor, then you need to give this couple more time. But if it's a older couple, even trying for 6 months with, say, a sperm factor, then directly they must go for ART treatment. So the first factor is age of the lady. The second factor is how long they have been trying. The third factor is associated factor. For example, if there is a tubal block, a very bad tubal block, and that is usually diagnosed on laparoscopy, then apart from ART, there is no other method available in most cases. Very, very low sperm count. It's called teratozospermia. Even in them, ART is the main thing. So these are the three most important points: the age of the lady, how long they have been trying, and what are the associated factors. And then you can just make the algorithm and decide when to provide the ART treatment. So I just would like to, talk in the same lines that you have mentioned is awareness. The audience must try to learn more about this treatment. And of course, there is a lot available in today's world. The internet has a lot to offer, but they also need to know that not every information on the internet may be correct or may be backed up by science. And of course, they need the information, but they also need to, an engineer can do the engineer's job well, a doctor will do the doctor's job well. So after the information that they have gathered, they need to sit with the doctor and discuss the points and have an open discussion. And at the end of the day, uh, if at least take a guidance from the fertility specialist who will have more knowledge and experience in this field, and to act on those recommendations sooner rather than later.